The opinions expressed in this podcast are those of the host and guests and don't necessarily reflect the views of WOWT.
If you've ever had to deal with a hospital, ever have to deal with a doctor, ever worry about your insurance and the payment, making sure you're getting the right pills and all that stuff, boy, we got a podcast for you. And I'll tell you all about it in just a moment or two. Welcome to the Becky's Talking Podcast, where every week we do something a little bit different, an interesting conversation with interesting people. And it's all brought to you by Havana Garage in the Old Market. Havana Garage, where, there's so much going on downtown these days. Summertime, you got concerts at CHI, you got, when you had the College World Series, you got plays, you got music, you got the park, things going on to the park, and all so much happening. Make Havana Garage part of your summertime activity. They got a beautiful park outside, a beautiful nice outdoor area to have a cigar and a cocktail and just relax and enjoy and solve the problems of the world. I tell Chaz and the folks over there that I sent you when you stop on by. If you'd be so kind, Havana Garage in the Old Market. Okay, look. Everybody has to deal with a doctor at some point or another. And if you've got parents who are getting up there in years, or maybe somebody that in your family that has to deal with a nursing home, or somebody that is in your family that's very sick, but you live far away, this is going to be an interesting topic for you here, because with me right now is Nicky and Becky Korinek, right? Mm-hmm. And they are with an organization that is called the Patient Advocate, right?
Yep, Outreach Patient Advocates.
Okay, so what is Outreach Patient Advocate?
Yeah. So we are a group, we're patient advocates who go out and help, especially seniors who don't have a lot of family or friends in town, and we help navigate the medical system or the insurance system. We take people to the doctor, we help communicate with the healthcare team, we take notes. We're the historian, because a lot of times they have dementia or Parkinson's and don't always have the history down correctly. So we help with the history piece of things. And then we help get them the resources they need to either stay in their home or help them get to a assisted living or memory care. And then we stay in contact with the family, the healthcare team, and just make it an efficient and effective visit.
How does this differ from a business like Home Instead?
Yeah. We're very different in some ways from Home Instead. So we actually pick them up, the client up, and we get into the medical records. We organize a binder of medical records and take that in. So we know if they've had an MRI, we bring that with them, because sometimes even though doctors can access medical records, this may have been faxed over and it could have been in a 259-page document. So if there's any scans or blood work or anything, we have it right here in our binder. So we take it in. So the doctor, we try and make it even better for the physicians and the nurses, so they don't have to go through that big medical record. So we differ in that way, where we take them, we communicate with the healthcare team, and then we also communicate with the family members.
Okay, now as I went to the website, I saw you had a bunch of letters after your name.
Yeah.
All right, so you are certified patient advocate?
Yep, board certified patient advocate.
What does that mean, and how is that different than, let's say, a registered nurse or somebody else in the medical field?
We are not clinical. So we do not do anything medical, but we help navigate and help guide. So we are able to research and bring information to the patient, to the client, so they can make a more informed decision about their healthcare. Because physicians are busy. When you go into their office, you may get 7 minutes with them, maybe. And so we help, when they give a diagnosis, we help find information and resources so they can make a decision about a procedure or about a medication that they need to start on. And then we're also certified dementia practitioners. So that means we've had some dementia training, because a lot of our clients have dementia or Alzheimer's. And so we help families, educate families, and then also help with any behavioral issues with the client.
Now, Becky, you are basically the office manager for all this. So is that what's your?
No, I'm the director of business development, so I'm front of the house. That's what I like to say.
Okay.
I do not do spreadsheets. I'm front of the house. So I do marketing. I speak to groups. I recruit employees. I tell everybody I meet what we do at outreach and how a patient advocate can
Is this something that, like, nationwide, do they have operations like this in pretty much almost every major city?
Yes, yeah, it's becoming more and more popular. I'm on a national group of advocates that, if we're struggling with a certain situation or an insurance issue, we can send it out on our platform, and somebody in that group has probably dealt with it. So it's great that we have our office mates nationwide. But yes, it's nationwide. I think we're the only group in Omaha that patient advocates, and then we also have care companions, which we started just a couple of years ago, which is like home instead, non-medical care companions.
Care companion, that just sounds like what, you rent a friend or something. I mean, what is that? What is a care companion?
Yeah.
So it's all non-medical. We warm up a meal. We play a game of Scrabble. We keep you company. Loneliness is ubiquitous in the senior community, and especially if you have some health issues going on, you might not be getting out very much. So we do some light cleaning. Like I said, warm up a meal. We run errands, go to the grocery store for them. Anything like that other duties as assigned, laundry. But a lot of it is companionship and checking on them just to make sure, that they're doing okay. So that's what a non-medical care companion is.
Is there a common thread to all of this? I mean, obviously if somebody is like 92 years old and weak and frail, that's one thing. But, somebody, before they get to that point, what do you do, or how does somebody know that they're going to need your services?
Yeah. I mean, anyone that doesn't have somebody to go to the doctor with them. Anybody, because you always need a second set of eyes and ears, especially if you're getting a diagnosis that, Parkinson's or cancer. Those words come out of the doctor's mouth and then you don't hear anything else. So it's nice to have somebody else there to take notes for you, even if it's a friend or a loved one. And so then you can talk about that after the appointment.
And there are often, things that you need to follow up on during those appointments.
Yes.
Like you need to get some PT. And a lot of times they'll call you, but guess what? Sometimes they don't. Yeah. So that extra set of eyes and ears is really, really important for just following up on all of the instructions that the physician is going to give you during that appointment.
Absolutely.
I recently, well, now it's been a little over a year ago, but had cancer surgery, and went through all of that stuff. And you're right. I've often said, when they tell you that you have cancer, everything that you hear after that sounds like the teacher in Charlie Brown.
Yeah.
Yes.
You have cancer. Because it just everything. And then with my particular surgery, they just were throwing all this stuff at me, and it was like hard to figure it all out. Now, I think I did. I think I'm okay. I think I got it done. But it is hard. Is there a common mistake or something to watch out for when dealing with a doctor, when dealing with a physician, when dealing with a hospital, to maybe make sure that these mistakes don't happen?
I would say medication error is a huge thing to watch out for. So I think it's really important to know the medications that you're on, why you're taking them. I talk to a lot of people who have been on medications for a long time, but they have no idea why they're on them. And so we always take a medication list with us. And anytime there's any sort of a change with that medication list, we put the date it was changed and why. If they decreased it, if they increased it, if they took them off the med and started a new one, why did the doctor do that? It's on the list. It's important to keep track of those things, because when you're seeing 5 different, an independent physician, the med center, CHI, things are going to get missed. And so to have one place where all of your medications. The other thing is unfortunately, a lot of times the nurse cannot take the medication off the list. It has to be done by the physician. And so the nurse is the one that goes over the medication list. So even though you tell the nurse, I'm not taking that medication anymore, the next time you go in there, that medication's still going to be on the list, because if the doctor didn't take it off the list, a lot of times It's still on there.
Yeah, I've had that happen before. It's like,
Yeah.
no, I'm not taking that anymore. No, because the last time I came in, the doctor told me to take this instead of that.
Yes.
And then, but you're right. It is still on the list.
There are so many opportunities for medication error. It's terrifying. We have a client who went in for rehab. He had an ortho procedure, went in for rehab. Those transition times are super vulnerable. And then went home with a pill pack. A pill pack is just from the pharmacy. They organize all your meds. And he was not doing well. He was so sleepy in the morning. And he does have Parkinson's, but it's early stages and he's doing pretty well. Well, they gave him his sleep meds at 8 a.m. And if Nicky hadn't double, triple checked those pill packs, everybody's human and humans make mistakes. And so, we figured it out. We got the meds at the right times, and he's doing much better. But we could talk for a couple hours about medication error and the implications of those errors.
How common is that?
Very common. And for example, it seems like it happens all of the time. I took a gal to have an eye surgery done, outpatient. We asked about the eye drops. They said, go next door to the doctor office and get the eye drops that she needs. I went over there and the doctor said 4 times a day. The nurse said 2 times a day. And I said, well, the doctor said 4 times. No, it's 2. Here you go. Take these. I said, I'm sorry. Can you double check this? And she was giving me cataract eye drops. She didn't have cataract surgery, so just take that extra time and double check everything. It's okay to ask a couple times just to make sure.
Well, that's an interesting thing, too, because you say it's okay to ask. But it's fairly common to just go along and do whatever the doctor tells you, right? Okay, I want you to go see this specialist or do that, take this pill, whatever. Okay, and you're right. People do need to take, no matter if you're young or old or whatever, they need to take more control over their own health, don't they?
Yes. People need to become more engaged in their own health and take control themselves. Ask more questions. Be prepared. We try to empower our clients to come in and be prepared. So, for example, we take a 1-sheet paper with their concerns, with their past medical history, the main things that we want to get across to the doctor. It keeps us on track, so we're not getting off track talking about something that, maybe the doctor doesn't need to know. The 5 things that we want to go over with the doctor, or the 3 things that are most important, which comes from the client. We don't, we ask the client, what do you want to go over? So it helps everybody stay on track. And then you don't forget, oh my gosh, I forgot to tell the doctor about my headaches I've been having. I mean, we've all walked out of the doctor thinking, darn it, I forgot to tell them that. Well, this is where we also help track symptoms. So you don't want to wait 6 weeks to get into the GI doctor and not track your symptoms before you got there, because what a waste, right? Bring in all of the information that you can to the doctor to make that the most effective and efficient appointment that you can.
Especially with the GI, we really treat the doctor like a detective, and we want to give the provider as many clues as we can to get to the bottom of the diagnosis. So if you're having GI symptoms, you want to track every bite you eat, every BM, every ounce of water, every bit of exercise, because those are all factors that the physician's going to look at.
Mm-hmm. You say you ask the patient, what do you want to cover? What do you want to talk to the doctor about? But then you also say you're dealing with people with dementia.
Yes.
Do they even know what they want to cover?
That's a great point.
I think that's why I'm here.
We deal a lot with the families. Sometimes we'll get a call that says, I have no idea even where to begin. My mom is forgetting things. She lives alone. She's 90. What do I do? And that's where we come in and we help get them to a geriatrician or get them a neuropsych eval. We can help discreetly get that information to the doctor so
How do
they
you do
know.
that? Talk about that, because that can be a little tricky.
Yeah. We talk to the families and get examples of what's going on. What do you mean your mom is forgetting things? Give me 5 solid examples. And then we can take that information to the doctor. And, like I said, we bring in a sheet of paper. We give that to the nurse to let them know. But sometimes we'll even say, discreet note to doctor. And then sometimes that will prompt them to ask some certain questions, because sometimes mom will go in there and be able to answer all of the questions, and the doctor will think, well, they don't have any memory issues. They know all of this. But if they have a little bit more information, the doctor, about the forgetfulness, that may prompt them to ask some other questions in that appointment.
What do you do about the attitude? And by that, I mean, you get some cranky old fart who done there, and I don't need you. I'm fine. I'm still 22 and that I can, I've seen people like that. I'm rapidly becoming one of those people myself. So what? How do you deal with that sort of an attitude?
So you mean like if we're helping this client because their kids are out of state, for example, and they don't really want the help?
Yeah. Who are you? I don't need you.
Yeah.
I'm fine. I'm staying in my house until I'm 99 years old, and I don't need your help. Get out of here.
Nikki's the sweetest thing in the world, and just great at building those relationships. And I think that when our clients, the older folks see how much we can improve their life, like they're convinced, we do have a client that we just simply check on every day. And she's like, you don't need to vacuum. I'm the only one who lives here. And we're thinking, girl, it has not been vacuumed in a hot minute. But we take her to Long John Silver's. We take her to get her hair done. So it's just relationships.
So wait a minute. You say you're there for their health, and then you take them to Long John Silver's?
You know what?
Come on.
This lady's 90. She's killing the game. Yeah. And so, you know what? If she wants a little deep battered fish, we don't recommend it, but yeah,
by the way, in case anybody from the Long John Silver's legal department is listening, I love Long John Silver's myself. But that is, this is all, so it's got to be a rather complex little dance you have to do with a lot of these patients.
Absolutely, yes. We have clients, one that lived in her home and was really experiencing some dementia. And the neighbors were worried about her. Her friends were worried about her. Her brother, who's the POA, lived, on the East Coast.
I'm sorry, POA? Power of attorney.
Power of attorney, yes, yeah. And so, it was a struggle. But it took relationship building, me stopping over every day and checking in on her, bringing her some of her favorites, and just really getting to know her, building that trust.
You say you're certified. Uh-huh. Who certifies you?
It's through the board certification of patient advocates. It's a board. It's a national board, and so it's. I'm not sure how many people are on the board, but yes.
Okay, so this is a national recognized board. That's. I hate to, sound this way, but I'm going to sound this way. This sounds like something that could easily somebody could just open up a place, put up a shingle and say, hey, trust me, I'm certified, and do the same sort of thing, right?
Absolutely. You do have to take a test, and it is, it's
rigorous.
It's a pretty rigorous test.
Is there a school that you have to go to beforehand and so many hours of education beforehand?
I took a lot of continuing education classes before I took the test myself. And then we just brought on 2 other board certified patient advocates. I kind of helped guide them in what they needed to study. Any continuing education that they needed, because you need to know about Medicare and Medicaid and just regular health insurance, and the ethical piece of it about helping clients, especially seniors, because they're a vulnerable population. So there's a rigorous test. Not everybody passes. And so, and then if you pass, you get the certification. And then you have to have so many hours of continuing ed every 3 years.
Now, you mentioned Medicaid, not bringing this up, only that I have a brother that had a stroke, and he's in a nursing facility.
Yeah.
Okay. My sister, who's a rock star for this sort of thing, is handling all of the paperwork.
Wonderful.
So far, everything seems to be going smoothly. She seems to be the patient. She is the patient advocate.
Wonderful.
I go visit the guy and say, how you doing? I take him out to lunch once in a while, to Long John Silver's, and that. But she handles like all the paperwork and all of that, and the doctors and all of that stuff, right?
Wonderful.
I think it's all going well. Are there things that need to be looking out for that, might be a mistake or something that we just don't know to look for, or that she might be missing? Without knowing all the details, that may be hard to answer.
Yeah,
but
it is. It is hard to answer. It's great that she is doing all of that, because a lot of times families don't have that person. I would just, medication, I don't know. It's hard to say, but medications, I would say, to really keep track of the medications and what the doctors are saying.
So basically just communication is the key.
Yeah, for sure.
Okay, now we get to, the fun part.
Yeah.
This is not covered by insurance, is it?
No. It's so hard. There's times where I wish it was covered by insurance, because we could really help so many people. However, then, the insurance company would tell us what we can and cannot do, just like the doctors, right? We do have, there is a board of advocates who are trying to work on that and get it covered through insurance. And so we're trying,
Yeah.
But otherwise it's all private pay. Long-term care insurance does cover the care companion side of things, but not the advocacy side.
How much is it?
Yeah, well, it kind of depends. We can either do an hourly rate or we can do packages. It depends on how much we're going to be involved. If it's going to be something that we're going to be involved a lot in, we can set up a package. We can say, okay, we can do this, and we'll do it every month, and it'll include this many doctor visits, this many phone calls. So it really kind of depends on the situation.
You got a patient that you are, well, let me ask you this. I would imagine it's rather expensive, though. Healthcare in general is expensive. Mm-hmm. And this would be something that, somebody would have to have a few bucks in their pocket to be able to do this. So you've got somebody, okay, you're taking care of them. The kids live out of town. Mm-hmm. Kids live out of town. Mom falls down a flight of stairs, has a heart attack, stroke, something along those lines. Do you get involved in anything like that, or that's like for the doctors to take care of and the EMTs and?
Absolutely. Sometimes we're listed as the very first call. Besides 911, we're the person that they call. I've had somebody call me at 2:00 in the morning. Can you meet me at the ER? Can you meet my mom at the ER? Can you take my mom to the ER? All hours of the night. We're there to be by their side. We had a gal leave from memory care. She had fallen, and they put her in the ambulance, and they give them a piece of paper from the memory care because they don't have the staff to go with them. So here's this gal that's going to, that has dementia, going to the ER with a piece of paper. And so if they didn't have us, their family is on the East Coast. Mm-hmm. So if they didn't have us, they would just show up at the ER and wouldn't be able to answer any questions. So except for this, history of this piece of paper that they get from the memory care unit.
It's tough, isn't it? Both my parents have passed on, but having dealt with that, it's hard. And I was fortunate, at least, in that my folks, their mental capacities were still there. Their bodies gave out on them, but their mental capacities were still there. So didn't have to deal with a lot of that other stuff where you just watch your parent, they don't even recognize you and things along those lines. It's a tough thing. What is the average age of your patient?
Ooh, average age, I would say, is probably 78.
Yeah, we've got a couple on either ends of the spectrum that kind of mess with the age, but I would say that's a good ballpark.
Probably 78.
78 or so would be that, yeah.
Yeah, we've got, a couple of 95, 90s, and then some, a couple of late 60s.
Do you pretty much just the Omaha area itself, or like if somebody is in Red Oak or Wahoo or wherever Waterloo, you would cover that too?
Yeah, one of our very first clients was in Columbus, Nebraska, and so we would drive to Columbus and help them, and it was a lovely experience.
Last question here? What do people need to know about this? I mean, it's a thing where, the relative, the mom and dad getting up there, you don't know what to do. What would you tell them? And let's say they can't afford you, okay, but they still want to be able to take care of mom and dad, but they're living out of town or whatever. I mean, is there any other options, or are they just sort of screwed in this sort of a situation?
I would say, for me, if somebody calls, and I kind of talk to people over the phone and help guide them over the phone, especially if they've got somebody here and, say the daughter or the son is really involved, I'll kind of just guide them over the phone and say, here's the next steps that you need to do to get your mom on the right path. Because it's intimidating and people don't, if they're not in it, you may not have any idea what that next step is. So there's that. And then, we're always here to help, I would say.
Okay.
Yeah.
And I imagine you have a website. So if somebody wants more information on this, where would they go find it?
Yeah.
OutreachPatientAdvocates.com.
OutreachPatientAdvocates.com. Nicky, Becky, thank you both very much for being here. It's interesting because this is an issue that a lot of people have to deal with. Mom and dad getting old, and you may not even live in the same town, or they've got their own problems, and it's I mean, just let's face it, if mom and dad are on the upper end of that, good chance that the kids are getting up there in years too, and so
exactly. We had a client recently who she is in good shape. She's in a community and doing really well. Well, she's alone, but she does have a daughter who helps her out quite a bit. Well, this daughter had scheduled a 10-day trip out of town to take care of her own grandkids, and the mom fell twice in that week before she was going out of town. So she's between a rock and a hard place. She's committed to going to take care of her grandkids, but here's her mom. There's nobody else to help out with mom. So we just stepped in temporarily. She's actually not a client anymore. We just, we helped her with showers, just short-term.
So it's short-term stuff too.
Yeah.
So it's not all just long-term, till the grave and that. Okay.
Yeah.
Yeah. So just, okay. That's very interesting. And again, the website is?
OutreachPatientAdvocates.com.
Nicky, Becky, thank you very much for being here. Make sure you join us every, whenever you can, actually. I guess I say every Tuesday. Yeah, we put a new one every Tuesday, but, you can go whenever you want. Subscribe to the YouTube channel. You can check out podcasts that you may have missed. Subscribe so you don't miss any future podcasts. And, of course, follow us, because you got to be on Facebook, right? Follow us on the Becca's Talking Facebook page, if you would be so kind. Till next time, thanks to the folks at Havana Garage and the Old Market for being here for us. And make sure you go out and visit them and enjoy yourself. Relax, take it easy, have a cigar, have a cocktail in their atmosphere there with the Rat Pack and Dean and Sammy and, of course, Old Blue Eyes. Yeah, check it out, Havana Garage and the Old Market. Thanks to them. Talk to you next time. Take care, and bye, y'all.